Introduction. Penicillin V, also called Phenoxymethylpenicillin, is a narrow-spectrum antibiotic belonging to the penicillin class. It is mainly effective against gram-positive bacteria and is commonly used to treat mild to moderate infections. Point 2. Mechanism of action. Penicillin V works by inhibiting bacterial cell wall synthesis. It binds to penicillin-binding proteins, PBPs, and prevents the cross-linking of peptidoglycan layers, which weakens the cell wall and leads to bacterial death. It is bactericidal in nature. Point 3. Spectrum of activity. Penicillin V is most effective against Streptococcus species Pneumococcus. Some anaerobic bacteria. Non-penicillinase-producing Staphylococci. It is not effective against organisms that produce penicillinase, beta-lactamase. Point 4. Indications. Uses. Penicillin V is commonly used for streptococcal pharyngitis, strep throat, tonsillitis, skin and soft tissue infections, dental infections, rheumatic fever, prophylaxis, mild upper respiratory tract infections caused by susceptible organisms. 5. Dosage. Dosage may vary, but general adult dosing is 250-500 mg orally every 6 hours. Children, doses based on weight, usually 25 to 50 mg/kg/day divided every 6 hours. It is taken before meals because food can reduce absorption. Point 6. Pharmacokinetics. Well absorbed, orally stable in acidic gastric environment, better oral stability than penicillin G, widely distributed but poor penetration to CSF unless meninges are inflamed, excreted mainly by kidneys. 7. Side effects. Common side effects include nausea, vomiting, diarrhea, skin rash, allergic reactions, from mild rash to anaphylaxis, rare, hemolytic anemia, interstitial nephritis. 8. Contraindications. Known allergy to penicillin or beta-lactams. Use cautiously in patients with kidney problems. 9. Drug interactions. Probenecid increases blood levels of penicillin V. Certain antibiotics, like tetracyclines, may reduce its effectiveness. 10. Precautions. Patients with a history of allergy should be monitored. Complete the full course to prevent resistance. Dose adjustment may be required in renal impairment.